this is what you should see. The endotracheal tube is at the top. You can just kind of see that shiny device above the epiglottis. The epiglottis is that organ sticking out towards you, and it's all lifted up, and you're looking right down at the cords. Easy to intubate that. This position, where you're looking at the cords, can be then further categorized according to its McCormick-Lehane classification. And the ideal position is a class 1, which is perfect view of the cord. You're looking right at the arytenoids, which are the little bumps at the bottom of the slide, just at the base of at the bottom of the cords, and you're looking right down the airway. That's the ideal position. And you should be able to intubate in that situation very quickly and easily. Class 2 is also pretty good. You've got a little less of a view. You've got the epiglottis coming down a little bit over the cord, so you're losing the top of the cords, but you're still seeing 50% of the cords, and you should be able to intubate. It's when you get to 3 and 4 that things become more difficult. With a class 3 airway, you may see a little bit of the airway, and this is where a bougie sometimes helpful, because you can slide the bougie underneath that epiglottis and get it in through the cords and then pass the tube down over the bougie. But this is a difficult situation. And then the worst is class 4, where you can't see the airway at all. All you can see is epiglottis. Sometimes what you see is the epiglottis kind of stuck to the posterior pharyngeal wall, and it just won't move. And this is where you're getting into trouble with intubations. So this is how we can use an LMA to intubate a patient. We can either use a standard LMA and pass a narrow gauge tube down it, about a 6. And it's a tight fit. I've done this, and it's a tight fit, but you can get it down. You should use the fiber optic scope to look and make sure that the end of the laryngeal mask is actually adjacent to the cord, so you can see where you are, because as I mentioned earlier, even when the LMA is out of position, you can sometimes ventilate okay. And with the bronchoscope, you can tell exactly where you are. So you could force a tube down through that. With the intubating LMA or the fast track LMA, it comes with a size 8 endotracheal tube that is made of silastic, which is a plastic material that slides more easily. It's got a bigger barrel than a standard LMA, and you can get the 8 tube through. So particularly for a man, that's a better size than a 6. A 6 is small for a man or woman. So this is intubating through the nose, and it's interesting when you pass a tube down through the nose after you've prepared the nose, as I mentioned earlier. Sometimes you don't have to do much of anything to guide it towards the curve. The natural shape of the endotracheal tube is such that you can often just push it down, look through the mouth, and you'll see the tube coming past the palate into the oropharynx, and it comes forward very nicely right through the cords. If it doesn't, you use this right angle forceps called a McGill forceps to lift the tube end, the tip of the tube, and direct it down through the cords. So this is intubation using fiber optic bronchoscope, both orally on the left side of the diagram and nasally on the right side of the diagram. And it basically just shows how the fiber optic scope is passed down through the airway, and then the tube is slid down off the scope, keeping the scope in place until you've got the tube down off it and into the airway. And then you can remove the scope, check for position of the tube, and hopefully you'll be home free. So this is what the cords look like through a bronchoscope. Look basically the same as the way they looked just using a Macintosh blade. The only thing is you're closer. You can see you're a little bit closer. And if you were doing an awake intubation, this is where you would spray a little bit of lidocaine on the cords before you pass the bronchoscope any further. And in this picture, you can see the endotracheal tube going underneath the epiglottis and through the cords. And that's what you should be able to see once you've intubated and you have another look, just to make sure you're in the right place.
You just completed your first video of the world's best medical exam preparation. Lecturio brings the knowledge of worldwide leading medical experts and teaching award winners to your PC, tablet, or smartphone. Prepare yourself and check your progress with thousands of quiz questions customized to USMLE standards. And the very best, you can get in touch with our medical experts personally. Visit lecturio.com now and continue with the most inspiring medical education around the globe, anytime, anywhere.